medicine at all, because maybe the child is just going through a rough patch. Like maybe they're poor, and being poor makes you depressed. And that maybe is your mind saying being poor doesn't really work for me, so I'm gonna feel some kind of way so that I intrinsically get better. But I think that some of the pushback with the I'm gonna say, because I work in a Black community and our children are very over medicated. And I noticed that a lot of that culture has been indoctrinated into the parents. Like we have to start saying no. Like when we're told that there's something wrong with our child, we have to do a little bit more due diligence, and medicine can't be the first thing we do. And I think that a lot of this happens within the educational system, and we have to realize that children today don't learn, and they're not the same as children yesterday. They get highly, they're technologically savvy. They have other choices. They don't play the same, they don't learn the same, they don't think the same, and I think sometimes we don't know what to do with them, so we drug them. And I'm gonna say, in Marin City, we have a program called the Defenders and another one called Girl Power, where it's a part of our preventative behavioral health program. And that we take children on a 4-week van trip around the country. And the first year that we added boys, we took 20 children and we had 10 boys. The majority of them were medicated. And the rule was, if you come on the trip, you can't take your medicine because we can't be responsible for that medicine with 10 children. Every child did supreme. Like when it was time to be bad, they were bad. When it was time to be good, they were good. They were just children. And after that trip, one of them came up and said, "Thank you for taking me off the medicine because it's embarrassing. Everyone knows I'm on the medicine and it's really embarrassing." So I think that some of that is us as a community taking back control of our children's space and making space for them to just learning them, like just appreciating that they're not the same children, and pushing back on these schools who tell us that our children need to be medicated to sit down and learn. From that 4-week trip, we know that our children learn when they're in something, touching it, smelling it, doing it. We see them pick up concepts that they should have picked up throughout the school year, but they didn't for whatever reason. So I think that, part of it is us. I'm gonna put it back on us. And when we see our children come in with all of this medicine, we have to do something. We can't defer to this provider to tell us who, we live with these people. They're in our community. So we kind of have to surround them with the support that they need to be well.